The most important thing to know about fertility acupuncture before you commit to treatment is it is painless, comfortable, relaxing. My name is Sarah Prater, and I'm the owner and acupuncturist at the Tennessee Center for Reproductive Acupuncture. We're Knoxville's first and only fertility specialty practice, and we love what we do.
My name is Kate Sisson, and I'm an acupuncturist at the Tennessee Center for Reproductive Acupuncture. Here we work a lot with women in all stages of their fertility journey, whether they're trying naturally or using a medicated cycle, working just with their OB or with any reproductive endocrinologist. And we've got acupuncture protocols for each stage of the journey to support what your body is doing naturally or what it needs help doing with the medication.
Acupuncture works by increasing blood flow to the uterus and ovaries, so that can help in a few different ways by increasing the health of your follicles or your eggs, increasing the thickness and the quality of the endometrial lining to make a more hospitable place for implantation for an embryo. It can also help regulate hormones, so it can help encourage normal ovulatory cycles, normal length cycles, can help with luteal phase defect issues, or any other hormonal problems that a couple may have.
I believe that first appointment, she spent at least 30 minutes, if not more, just talking to me. And so to be able to sit there and have that conversation with her and to have her really go in depth and ask me all these questions was just so refreshing.
We assume that every one of our patients has never had acupuncture before, which is true for most of our patients. So we spend a lot of time really talking about the treatment, how it can be beneficial for each patient's individual situation, cycle, diagnosis, etc. And then really walk through what a treatment is like, so what they can expect, what it might feel like, what to communicate to me during the treatment, how long it'll last, when to come back, what that treatment course might look like over the course of their whole fertility journey, depending on their specific plans for the future. So we really try to go over everything in detail so that there aren't any questions. We go over fertility history as well, health history. We want to know how you're sleeping, how you're eating, what your stress level is like, what your digestion is like. Some of these things may seem kind of strange to someone who's never had acupuncture before, but they really help us guide the treatment and give you the best outcome we possibly can, whether that's through acupuncture, through dietary recommendations, through lifestyle recommendations, or any other suggestions we might have.
Acupuncture is like going in for a spa massage or a spa treatment. It's something I can do for myself. It's relaxing, and then you get these amazing benefits. For me, it helped me get pregnant and regulate everything, so it's a completely beneficial service, but also relaxing and something I can do for myself.
We determine the best course of treatment by working with each couple specifically. So it really comes down to, first and foremost, what type of cycle they're doing. So it really is very patient specific, and something that often happens during fertility treatments is things change course. So an IUI may not happen the scheduled day that you were expecting when you started the cycle, or it may get canceled, or you may switch and end up in an IVF cycle when you weren't really expecting it. All of these things we take into account as we go and navigate that path the best we can and make the best recommendations.
We always ask about the testing that you're receiving and the plans that your provider, how often you'll be seeing your provider, and really focusing our treatment to support that. So if you've got an intervention coming up, or there's certain medication regimens that are being changed in your fertility cycle, then we modify our protocols to support that and make sure that we're seeing you at the optimal time.
A typical course of treatment really depends on what the couple is doing. So for a natural cycle, for example, we'll usually see people about 3 times a cycle. Those treatments are timed with your cycle to give you the best advantage to get pregnant that particular cycle. For couples doing IUI or medicated cycles, we try to time things a little bit more carefully with when you're on medications, when you're going through certain procedures, that sort of thing. With an IVF cycle, it gets a little bit more involved depending on the type of cycle. So is it a frozen cycle, a fresh cycle, a retrieval cycle, for example? So we would work with each patient and kind of come up with a treatment plan that works specifically for their cycle. Treatments typically last about 90 minutes for a new patient. We'll take about an hour or so of that time, talk about your fertility history, your health history, and really answer any questions you might have about the process, the timing, expectations, fears. There really are no stupid questions. So this is a new experience for a lot of people, so we really want you to be open when you come here to see us. Follow-up visits last about 60 minutes, and we take some time to go over what you're going through, how your recent test results have been, what you're feeling about those test results, what treatment recommendations your doctor is making, and how that might change what we do in an acupuncture treatment, and then we do the treatment. The most common fear is that acupuncture is going to be painful. So fertility patients are often poked and prodded in more ways than they ever want to remember. So to add more needles on top of an already pretty tough process can be very scary. So we really walk through exactly what the needles look like, what it can feel like. So the needles are about as thin as a hair. They're actually flexible. You don't really even feel them when they go in, which I know sounds a little bit crazy. But once they're in, you'll actually relax. Some people fall asleep. It's equated with getting a massage by a lot of our patients. Acupuncture is backed up by a lot of research studies showing that it can be beneficial for all types of fertility situations. So, for example, there's research showing that acupuncture can help patients with PCOS ovulate on their own again, which for some patients can be, the trick to getting pregnant. It's also been shown to be very helpful for IVF. So there's certain protocols that are shown to be helpful. For example, a treatment pre and post embryo transfer can be immensely helpful in increasing implantation rates. So the research is really what we fall back on to drive everything we do here at our practice. We keep track of statistics for our IVF patients. So over the course of the last 6 years that we've been keeping track, out of all of the patients doing IVF, we see a 60% pregnancy rate. Most of our patients find us online or through their fertility doctor. We do get referrals from the doctors here in town. Most patients will just give us a call, and we're happy to go over their cycle, make recommendations about when is appropriate to start treatment, what they might want to know, answer any questions they might have. We're really, really available for our patients. If you don't feel comfortable making a phone call, maybe you're at work and you don't want to be talking about your fertility issues around your coworkers, we are very, very responsive via email. So you can email us through our website and we'll usually get back to you, within a couple of hours at the most. Fertility, as most of you know, can be a tumultuous journey, so we really do our best to help our patients navigate that successfully and do everything we can do to support them along that journey, whatever that means.
Some of us need that extra support. I too felt hopeless, like this would not be my reality, and I'm here growing a baby.
I do what I do because I absolutely love the feeling of helping couples along this journey. The fertility journey is really, really tough. It can be lengthy, it can be trying. For me, nothing beats the feeling when a patient comes in and finally gets pregnant, finally shares their picture of their ultrasound or their baby with us. It's just the most wonderful feeling for me.
I can't even explain how it changed my life because I have a baby, I have a son that I wouldn't have. It's changed my family, it's changed everyone around me.